And I just want to start off by thanking y'all so much for this incredible opportunity that we've been given. But I think about the things that happened over the past 2 years. It's been a short period of time, but in some ways it's been a long period of time, but in some ways really short. I'm involved right now in meetings with hospitals and work groups to try to work on different projects that were started and really energized through a memo that Bill Pulley wrote. 2 years ago, I'd never heard Dr. Iron speak. I had never seen Steve face-to-face, hadn't met Maggie, didn't know John. Some of the things that have happened over the past couple of years and just being in the same room with people who are really making the improvements in healthcare in North Carolina have been huge for me personally, and I just can't be thankful enough for that. And I promise that I'm going to be a good steward of what I've been given and use it as well as I can. I'm involved in work groups right now where the things that I've learned through my project, I'm going to be sitting in the same room with people that are putting programs and things into place, and with the experience that I have from working on my project, I'm going to be able to bring those things into those rooms and help people see how some of the plans that they have will work well in the primary care setting in rural areas, and how some things won't work well and need to be changed in those settings. My second year, and I'm looking at my watch, John, my second year in the Army, Uncle Sam issued us computers, and one of my roommates had, his father worked for the Department of Defense, and he was playing on his computer one day, and I said, "What are you doing?" And he said, "I've gone to," he said, "I'm on a bulletin board where I'm posting a message for my dad, and he's going to write me back." And I had no idea what he was talking about, but what he was talking about was the internet before I knew that's what it was. So fast forward 20 years, and I'm sitting in my living room last night, got my 2-year-old in my lap, and I pull out my one of these silly little things that y'all probably have, and I'm on Facebook, and I'm looking at a video of Ron's son eating oatmeal for the first time that his wife posted probably 15 minutes before I pulled it up. And my son says, "I want to watch it again, I want to watch it again, I want to watch it again." And over that same 20-year period, in a lot of these rural practices where my project was involved, the innovations that they made were to put some computers in so they wouldn't have as many paper demographic information, not for electronic medical records, but just so they could transfer over to electronics for their demographic information. And they stopped smoking inside the office. And those were over that time period where all that innovation happened on one side, it just didn't transfer into the primary care setting. In one of the practices where I did my project, the provider had one computer that was allowed to be connected to an internet browser because he knew that viruses came through the internet, and he didn't want to have viruses on computers in his office, so he had that one computer. Since then, he's come a long way, but not necessarily just because of my project. But I also want to take a second and thank the two mentors for my project, Dr. Jim Jones, who I know y'all know, and Henry Hawthorne, the CEO of Columbus Regional Healthcare System. They were very inspirational, and they not only just provided me feedback and answered some of the questions that I had, they really provided a lot of direction and a lot of insight that I would not have gotten otherwise, so I really appreciate that. A few years ago, I worked for an ophthalmologist, and he got really excited on Friday mornings. We all got excited on Friday mornings because it was almost the weekend, but he got really excited on Friday mornings because he would schedule patients secretly off of the schedule before 8 o'clock in the morning to come in, and they wouldn't even stop in the waiting room. He'd get so excited about it. They would just come straight through the waiting room. They'd come right back to an exam room, go in and sit down. He'd run in, do what he had to do with them, and then about 8:45 or 9 o'clock, he would just hand me a stack of charts. And that was probably his most exciting time throughout the whole week, because instead of being encumbered by the check-in process and the workflows in the practice and and all the other things that had to be done to get a patient checked in and checked out. He was just able to do what he loved doing, what he wanted to do with these patients, spend some really energized time with them, and send them on his way. And I think although we have providers that, like all of us, sometimes are resistant to change and doing things in a different way, I really truly believe in my heart that these advancements in technology and primary care are going to be able to give providers back some of this excitement like my friend had in his ophthalmology practice. By using these technology tools, we're going to be able to change things in a way that benefits the patient, that benefits the provider, that increases staff satisfaction, and is more efficient for everybody. And when these things are done within an individual patient, the whole medical community is going to be able to have access to that information in a secure way that's going to be really exciting. There is going to be some scary points along the way for some people because, like I said, it is going to require people to change. It reminds me of that story of the guy who was going across the Sahara Desert. He was carrying a car door, and somebody rode up next to him on a camel and said, "Why are you carrying this car door?" And he's like, "Well, just in case if it gets really hot, I can roll the window down." I mean, we get stuck in these patterns of the way we think about things needing to be done. But now that we have advancements in technology and other things that are available to us, we don't have to do business the way that we've always done it if that's not the best way. So it allows us to look at things in a new way. So let's see if I hit something. So my project was to introduce some technology tools into practices and work with them to help use those technology tools to look at data and help improve quality of care. So we implemented what we used was the provider portal, the community, I can't say provider portal anymore, everybody's got a provider portal. The Community Care of North Carolina provider portal is what we use, what we implemented in these practices, and we were successful in implementing these in our secondary goals for affecting quality improvement and reducing ED visits and 30-day re-events. That's difficult to look at just over a 2-year period, and I'm skipping around on my slides, so of course I've already acknowledged these folks. But so we implemented it, and we'd sit in front of providers and they'd say, "Oh man, this is really cool. I love what this provider portal can do. It's like you can look at this, look at that, look at the other thing." And then we have these things called, we have these reports where we can look at usage. So we go back after we did the initial implementation, we'd look 30 days, 60 days, and we'd be like, these people lose their usernames and passwords? I mean, they're not going in the system, they're not logging in, they're not using it. So although they thought it was a really cool thing, the data was overwhelming to them at times. We showed them 10 or 15 different things that the system could do at 1 or 2 sittings, so they were completely overwhelmed, even though they were doing a lot of what patients will sometimes do in primary care. You know, when you ask them if they're taking their medications and that sort of thing, you know, they did the nod and smile. Yes, everything's going great, but they weren't using the system. So one of the things that we learned from our project was that you can lead the horse to water, but you can't always make them drink because maybe you're trying to get them to drink from a fire hose. We were doing things like talking to them about how great it would be for them to use this provider portal system for population management. Some of the practices that we were working with weren't doing population management, or they were only doing like 1 mailing a year to their patients who needed a certain test or something like that. So we had to back up and not assume that all these things were taking place, and just because they were excited about the system, not assume that they knew how to work it, put it into their workflows in their practice. And for a lot of practices, we were introducing this system at the same time that they were integrating electronic health records, that people were starting to talk to them about health information exchange, at the same time that they were working on meaningful use and a lot of other things. So it's a busy time in primary care with the data explosion, new skills needed at all levels. Look at some of the folks in the primary care practice that just didn't have the technology skills, or the provider didn't feel they had the technology skills needed to absorb all these new systems. But then some of those employees stumbled over some of these technology systems, but then they would pull out their smartphone and post something on Facebook to their grandkids. So it wasn't necessarily that they didn't have the skills, it was just the way that these technology tools were being introduced. The next steps is to, we work with practices in Bladen and Columbus County for my project. Ranked 100 out of 100 counties in healthcare outcomes, and then Bladen's right around 96 out of 100. So a target-rich environment for improvements, and really working with people that once the relationships we build, they're very interested in partnering with people to make positive changes. But the future of my project is going to be taking the things that I've learned. Like I said, I'm going to be in environments where I'm going to be able to sit down with folks, and when they say, well, we want to do this to roll out this new system, and I'll be able to say, well, have you considered doing this other option? And they'll say, well, what makes you say that? And I'll be able to say something along the lines of, well, as a Bernstein Fellow, my project centered around introducing technology tools to some of these practices. One of the lessons we learned was, so I really can't thank you enough for this opportunity, for what I've learned, for what it's meant for me personally, for interacting with the other fellows, and for truly being able to make a difference with patients that are definitely underserved in North Carolina, and helping the providers that are struggling to keep up with the data explosion and new technology tools that are out there.